and welcome to Wellness Wednesday with Dr. Latoya Wells. Thank you for joining me for another episode of Wellness Wednesday. I am Dr. Latoya Wells. For those of you who don't know me, owner of Wells Legacy Health and Wellness. We are a full service family practice and we see a myriad of patients for different reasons. We offer early morning, evening, and weekend appointments. We're looking forward to servicing all of your healthcare needs. You can check us out online at wellslegacyhealth.com. You can also catch us on social media, all the platforms. And if you need to give us a call, we can be reached at 321-306-6755. But check out the website to look at more information about the services that we provide. And so this is October, also known as Pink October, also known as Breast Cancer Awareness Month. October is also one of those months where we have several different health topics that are discussed and highlighted. But how dare I not start out October with breast cancer awareness? Before we get into our topic, so to speak, in terms of statistics and signs and symptoms and all of that good stuff, I want to take a moment to recognize and to celebrate some people who have impacted my life through their journey of breast cancer. My Aunt Gloria, I believe today marks, wow, it's been over 10 years. I can't think of the exact date, to be honest with you. One of my cousins posted it earlier and I completely forgot. But her death left such a void in the lives of so many individuals. And she passed from breast cancer. She was a breast cancer warrior and she dealt with breast cancer and taken way too soon from us and from family due to breast cancer. My Aunt Gloria was like a maternal figure for me. Her and my Uncle Melvin, they played such an integral part in my upbringing. And I would go and stay with them for the summers. And when they would come down, just enjoy that constant reminder that I had someone that I could go to. And so I'm just so grateful for her and her life and what she meant to me and her strength and resilience through that process. And I'll never forget her. I can recall when I was younger, she would say, "Toy, what do you want to be when you grow up?" And I tell her, "I want to be a nurse." And when I became a nurse, she was so proud of me and she shared with me just how proud of me she was. And so for that, just in her believing in me and pushing me and encouraging me, it meant the world. I want to also thank my cousins for sharing their mom with us. They shared their mom with a lot of cousins because there were quite a few of us that would be there during the summers. And they were military families, so they kind of moved to different places. So I got to see different places, Georgia and Homestead and Pensacola, you name it. We got to go to a lot of different places because they moved around because of the military. So my cousin Twana Mika, thank you for sharing your mom with me. I know what a void she left in my life. I can't even imagine the void of her not being here, the impact it's had on you guys. But I love you. I'm praying for you guys. My grandmother, Clay Rosie Whitehead. She was a breast cancer survivor, diagnosed pretty late in life with breast cancer and had a lumpectomy and did fine. She's no longer here with us, not cancer related, but nonetheless, she was a cancer survivor and a warrior. Also, a really good friend of mine and mentor, Dr. Marshina Jones, is a breast cancer survivor and warrior, and a really good friend of mine now. These ladies are like sisters to me. Dr. Shelley Ann Scott, who is still walking that journey and on the tail end of it, but was recently diagnosed with breast cancer and went through treatment and is still a warrior and walking this journey. A friend of mine that I met through Peloton exercise group, this bike that goes nowhere but takes you everywhere. Tamara, I just want to say thank you for inviting me to be a part of your journey and to be there to encourage you and to watch your strength and to watch your resilience and watch you continue to smile and continue to crush it when it comes to all things workout and just in life in general during that process. I'm just grateful for you. There's also an individual who had a major impact on many of the women's lives, married women, Shelly Reynolds. And her death, we watched her, we walked that journey with her, and we had faith, but it didn't turn out the way that we all hoped that it would. She got her healing on the other side, but she was a true example of a warrior, of someone who walked it out and who kept her faith in the forefront, even through that process. And so, if you're someone today, or you know someone who is battling breast cancer, and you're walking that journey with them, or you're walking that journey yourself. If you're someone who has been recently diagnosed with breast cancer, or someone who found a lump and not sure what it is, and you are in the process of making an appointment, or you're waiting for that appointment, or you're waiting for test results to come in, we are here for you. If you need someone to talk, if you are someone who is in the thick of the treatment, maybe going through surgery and having to have mastectomy, or have that conversation, or in the midst of chemotherapy, we're here. We're here for you. You have support. You have a community rallying behind you. And if you're someone who has been cancer free and has won the battle with breast cancer, and you're on the other end of being in remission, we salute you. And how dare I not forget a really good friend, Dr. Melissa, also a breast cancer survivor and warrior. I could go on and on and on and talk about the women in my life and those that I know personally who have walked this journey and who are still walking this journey. There is support for you. We are here for you. And it's so important that we rally behind those, that we get behind the cause, that we raise the monies, that we participate in the walks, that we do everything that we can to help bring awareness to that. And so that's why I feel like it's so important tonight that I touch on this topic. How dare I not in the month of October? We will talk about different topics throughout the month. As you know, every month there's many different health topics that are highlighted, but we're going to kick it off with breast cancer. I have on one of my breast cancer awareness shirts. I had to go change because I had on my Wells Legacy Health and Wellness. And then I remember I got to rock pink tonight. It says, in this family, no one fights alone. In this family, no one fights alone. And so you're not fighting alone in your journey of breast cancer. Wherever you are in that spectrum of your process, you're not alone. There's people out here rallying behind you. And I can remember when we were there for Dr. Shelly Ann Scott, her last treatment, where she was released, and the joy that we experienced with her being able to ring that bell to signify that she was done with chemotherapy. It was just phenomenal. And to see the emotions that she had around that day, and that still the journey continues for her. But we're here. We got you. Breast cancer awareness. You guys know I love statistics. I love to talk about stats and all the things. So we're going to talk about some statistics in terms of who's most at risk for developing breast cancer, and when do we screen, and what does literature and data show. Let's talk about it. When it comes to breast cancer, about 1 in 8 women will be diagnosed with breast cancer in their lifetime. When it comes to the survival rate for breast cancer, the 5-year relative survival rate for localized breast cancer is 99%. So if you have a breast cancer or cancer that's localized, meaning it's in one area, it has not spread, they can go in and remove that cancer, do a lumpectomy or what have you. The survival rate 5 years after diagnosis is 99%. Are you aware that men are also at risk for developing breast cancer? Yeah, that's the case. Men do and are diagnosed with breast cancer. And they are certain ones, depending on their family history, at risk for developing breast cancer. And for men, it's 1 in 833 men will be diagnosed with breast cancer in their lifetime. So it's so important that we get screening and get screened early. There's a genetic component. There's environmental components. There's many different things that will place us at a higher risk place an individual at a higher risk for developing breast cancer. When it comes to the signs and symptoms, there are some people who have no signs and symptoms at all, and the findings are incidental. They go in for a screening, and the images show that there's something, abnormal within the breast tissue, or they go in for another medical condition and they happen to find this cancer. It's great when it's found early, because then we have a better course of treatment when it comes to what the outcome will look like for those individuals. So some of the most common symptoms are lumps or masses. So a new lump that wasn't there in the breast or the underarm. That's why I stress knowing your body, paying attention to your body, doing your breast exams every year, every month, getting the screenings when it's time for you to get a screening. And there's some controversy, so to speak, when it comes to the breast self-exam, meaning you're doing your breast exam at home. But how are you going to know when something's abnormal if you don't know what your normal is? And the only way to know is to touch and feel, right? It's your body. Touch and feel it. Look at it. Get the mirror, stand in the mirror, check it out. Make sure nothing has changed. And know what it looks like from a normal standpoint. Because if something changes, then you'll be able to notice that quickly. Changes in the shape or the size of breast. So noticeable changes in the breast size. One breast may get bigger because there's inflammation within the breast. There's different types of breast cancer. And we touched on that last year, and we'll kind of touch on that a little bit here tonight. But I really wanted to focus on the symptoms and the screening tonight. So we may do more in-depth talk a little later in the month. When it comes to skin changes, there may be some dimpling or puckering or changes in the color of the breast. There's, as I mentioned, the inflammatory type of breast cancer, the breast get like this orange peel texture. If you ever seen the peel of an orange, how it has those crevices and just the feeling and texture of it, some breast cancers can show up that way, and there are no masses. Or it can just be a reddened area or irritated area within the breast. Or you may notice changes with the nipples, nipple discharge other than milk. So if we're not breastfeeding or lactating, which is breastfeeding, or pregnant and developing milk within our, breast or colostrum within the breast, there should not be any discharge that comes from the breast. And so if there's a milky discharge, or if there's a bloody discharge or something abnormal coming from the nipple, then we need to get that checked out. When it comes to screening, so individuals between the ages of 40 and 44 is optional, right? It's optional whether or not you get those mammograms every year. When we get to the age of 45 to 54, it's recommended that you get an annual mammogram. So let's just say you go to your primary care doctor or your gynecologist, and they order a mammogram. That will be a screening mammogram unless there's something that's found. Let's just say you go in and they're doing a clinical breast exam, we'll discuss that in a little bit, and they find something abnormal. There's a lump there that they find. Then you will get a diagnostic mammogram. But if it's just your routine mammograms, you should be getting a screening mammogram every year between the ages of 45 and 54. For individuals older than the age of 55, more mature individuals above 55 years of age, depending upon your history and depending upon what's going on, it's recommended that you get a mammogram every 1 to 3 years. And so for women, I'm sorry, I take that back, every 2 years versus continuing the annual. So you'll have that conversation with your healthcare provider, whether or not they want you to go to every 2 years. If you have a very low risk for breast cancer, there's no family history, there's not been any abnormal mammograms, things of that nature, that there's no genetic component that you know of, then you can go to every 2 years. However, some individuals will continue to do those annual exams based on their history and their risk factors of developing breast cancer. Now, when it comes to, as I mentioned, the clinical breast exams, this is recommended for women every 1 to 3 years for women between the age in their 20s and 30s. So between the ages of 20 and 30, and annually for women that are 40 and older. So what is a clinical breast exam? That's when you go in for your physical exam, whether you're going to your primary care doctor or you're going into your OBGYN or your gynecologist. They should be doing an exam on the breast. every 1 to 3 years for those women in their 20s and 30, and every year for women that are 40 and older. They're assessing the breast, palpating it, feeling, touching, kind of seeing if they feel anything abnormal. But chances are, if something's going to be found, many women find it themselves, or their partners find the abnormality because they know the body, they know that individual's body. And so when it comes to the self-exam, women should be familiar, as I mentioned, with their breast and report any changes that you find to your healthcare provider. So if you're doing your self-breast exam every month, you're looking at the breast, you know the changes that occur. If you're in your cycle, or if you're having hormonal shifts and things of that nature, the breast may, get a little tender or a change in shape based on what's going hormonally, but the structure of the breast should not change. There should not be any lumps. There should not be any, discharge from the breast, as I mentioned, unless you're pregnant or you're lactating. I can recall when I was 27 years old, I was doing my breast exam in the shower, doing my breast exam, and I felt something abnormal. I felt a lump. And initially, I kind of brushed it off. The next day when I was in the shower, I did the exam again, and I tried to figure out, okay, where am I in my cycle? Is it, that time where my breasts get tender and things kind of change up a little bit? That wasn't the case. And so the third day I did the same thing. I felt the lump and I made an appointment to go in. I have a family history of breast cancer, but it's in a maternal grandmother who developed breast cancer when she was older than the age of 50. So it didn't necessarily put me at a higher risk for developing cancer because of that. But the simple fact that I found this lump that was not there the month before was very alarming. And so because I knew my body and I knew what was normal, the abnormal was very abnormal for me, and it stood out. So it's so important that we know our bodies and we take heed when there's something that's abnormal, which is so important, and why I stress getting that physical exam. We want to make sure that we're being preventative when it comes to, and proactive when it comes to our healthcare, versus being reactive and then trying to play catch up if we've let something go for months and months and not know how long that lump has been, or that abnormality has been there. So pay attention to your bodies, touch it, feel it, look at it, right? We need to know every nook and cranny what it looks like, because if there's something abnormal, I guarantee you will notice it. When it comes to genetic screening, I mentioned genetic screening. There are some breast cancers that are genetically, because of your genetics, you are predisposed to certain conditions, and the same holds true for breast cancer. So who should consider getting genetic testing? So individuals with a family history of breast cancer or other cancers should get tested, genetic testing. And the genetic tests like the BRCA1 and the BRCA2 can help determine the risk. Walking this journey with a really good friend of mine, almost like a sister, recently, and just being there to support her, I learned a lot of information that I didn't know had changed. And there are so many different genetic markers, and they increase every year. And so making sure that if you have that family history and you know that you have a positive BRCA gene or things of that nature, something genetically is significant for you, it's important to go in and get tested. When it comes to counseling and genetic counseling, you want to talk to a genetic counselor who can guide you through that process of what it looks like in terms of what testing or what genes they're going to test you for, when you should get tested, if you're even a candidate for genetic testing based on your family history. And sometime I went to my GYN appointment this year for my annual exam, and we discussed the risk factors and we discussed the different testing. I have very dense breast tissue and also fibrocystic breast disease, meaning my breast develops these fibrous cysts. That is what we found when I found that lump. It was a fibrous cyst, and we were able to go in and do a biopsy on it to determine that it was not cancer. Thank goodness it wasn't. But because I have dense breast tissue, there's some research that's come out within the last few years about those individuals who have dense breast tissue, whether they should continue to get mammograms or MRIs of the breast. And so in having that conversation with my primary care provider and my GYN, there were some differing of opinions, right? And so just make sure that you know what the research is, you know what the guidelines are, that you're doing your research. And I'm giving you this information tonight. If you have dense breast tissue, if you have a family history of breast cancer, ask for a breast MRI. Discuss that, right? It may not be necessary for you, but at least you're having that conversation. At least you're understanding what the options are. And so individuals who do have a family history of breast cancer will likely need to get genetic testing to determine the type of breast cancer that they have. There are so many resources that are available for you and for family members of individuals who are dealing with breast cancer, who have walked this journey, who are actually walking the journey now. And it's important to check within your local community. I know October is a month where they do the breast cancer awareness walks, and they have different fundraising things going on. Get involved. Those walks raise money for research that can help individuals, that can bring light and shed light on breast cancer, and to hopefully come up with a cure for it. We're seeing younger and younger women diagnosed with breast cancer. We're seeing generation of women dealing with breast cancer. We're seeing individuals who are not getting screened, who are developed and diagnosed at a later rate, a later age, and they have a higher incidence of death because of the stage at which they are diagnosed, the stage of their cancer when they are diagnosed. So let's rally behind each other. Let's do our due diligence to get the screening, to get the mammograms, to take care of ourselves. When it comes to resources, there, as I mentioned, the local resource, you want to check with your local health department or your community and find out what's available. Simple Google search, cancer resources for cancer survivors, what have you. There's so many free and low-cost screenings. I see the mammogram trucks popping up all over. And next year, I'm planning a health fair for my church. And my goal is to try and have that mammogram truck, as well as some other trucks there, to offer screening to women, either free or low cost. And so there's different health events and health fairs that's going on that are providing individuals with resources and screenings at free or low cost. So if you don't have insurance, there's grant funding available for you that can help you get these screenings that you need. We just have to know where they are. Many states have programs, as I mentioned, to assist with screening and education. You want to visit your state health department. Again, Google is your best friend for that. Nationally, we have the American Cancer Society at www.cancer.org, or the Susan G. Komen Foundation at www.komen.org. And then you have the breastcancer.org as well. Are all resources in place for you to go and look for resources and find information on when you should get screened, resources that you can utilize to hand out and give to individuals. Resources for those who are walking this journey, or family members who are supporting those walking this journey. I mentioned the the breast cancer walks. How can we get involved? Show your support. Wear pink throughout the month of October. I had another really pretty shirt that I was going to wear tonight. I couldn't put my hands on it. And so you're going to see me all the month of October in pink earrings, pinked out. I'm going to turn my nails pink, get my nails painted pink, because I want to support, not just in wearing the gear, but getting out there and walking. Well, I don't know if I'll be able to walk this year because I have a fractured foot, but I'll do my best to see what I can do to support. Educate others. Share this information. I can remember, I think I was in my bachelor's program and I was doing my project, and I think even in my master's program, and I developed it even more, where I developed a buddy system within my local church of women to get together and buddy up and pair up to encourage each other, to keep them accountable. Did you get your mammogram yet? Did you get your mammogram yet? Press on your sisters, press on your girlfriends. Hey, did you get your mammogram? We schedule those nails appointments, we schedule the hair appointments, we schedule our wax appointments and all the other things. Save the tatas is a famous slogan, and it's not just a slogan that we say. We want to save the breast. We want to save individuals' lives, and it starts with getting the screenings to save the tatas, right? And so encourage each other. Put it on your calendar. Hey, when did you schedule your mammogram? I'm going to put a post on my social media. I've scheduled my mammogram. Did you? And I want women to be honest about it. There's so much stigma around this, and I'm running out of time. There's so much stigma around this. Oh, it hurts. Oh, I'd rather not know if there's something wrong. Well, we want to know, because if we're able to find it at an early stage, meaning when it's small and it can just be taken out, or radiation or what have you, we want to act. We don't want to wait and sit on this. I know someone right now that I know very well who was developed with a cancer many years ago and did nothing, not really much at all. And so now the outlook is different many years later. Let's take action. Let's do what we need to do to take care of ourselves. If you're a mother, if you're, you have a partner, you're married, you have individuals depending on you. You have girlfriends that are waiting for you, that are ready to hang out and enjoy you, but we can't do that if you're not here. And statistics are alarming in the African American and minority populations when it comes to screening and diagnosis of breast cancer. We are diagnosed at a much later stage than our Caucasian counterparts. So we have to do our due diligence. Girl, you got your mammogram yet? If not, let's schedule it. Right? Let's get it done. Let's get it taken care of. But we want to make sure that we are supporting each other, that we're showing up, that we're educating in each other. Is it going to be uncomfortable? Yes, it might be uncomfortable. But a few minutes of being uncomfortable can save you from months and years of dealing with a breast cancer diagnosis and all the things that come with the aftermath of that. Participating in the events. How can we help? How can we get involved? Participating in the events. There's many different walks that are going on. Many organizations are doing silent auctions. There's so much. They just had a Pink in the Park this weekend to celebrate those who are breast cancer survivors. And I'm not sure, but I believe some of those funds will go back into the community. And so we have to do what we need to do our due diligence. And me as a healthcare provider, I'm not doing my service if I'm not educating you guys, if I'm not encouraging you all to go get screened. Talk to your family members. Husbands, talk to your wives. Brothers, talk to your sisters. Families, talk amongst each other to know what's going on, what's in our lineage. What did our ancestors deal with? What did those who went before us, what did they deal with in their health? We need to know this information. We need to have those conversations. It may be uncomfortable, but they're warranted. We need to know what we're dealing with. As a part of your health screening, you should be discussing your family history with your healthcare provider. That's a part of your physical exam. Because if we know what that health history is like from your family, then we have a better predictor of things that we need to get you screened for. The slogan, Save the Tatas. We're going to band together to make sure that our sisters, my friends, my girlfriends, my close circle are doing what they need to do to save their lives by getting your mammogram. I scheduled my mammogram. Did you? This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Stay safe and be well, and schedule your mammogram. Until next time, stay safe and be well.